when we finished our last lecture, we were talking about interviewing, and I had introduced the topic about naturalistic observations. Now, the authors of your textbook put it in this chapter, so we're going to deal with it here, but it's not really what we tend to think of as as an interview. Naturalistic observations, for the most part, are trying to observe people in the setting that they're in and then draw inferences from it. But clinical data have been gathered. Now, one of the examples that gets used, that clinical psychologists really do use, is the idea of trying to create an environment that is similar enough to what the patient normally experiences that you may be able to gather more accurate data about what this person experiences. One of the ways that's done is to have what's often called the empty chair. You have an extra chair in the room, and you have the client or the patient imagine that someone is sitting in that chair. Could be a significant person in their life, like might be their spouse or their lover, might be their boss. And you then have the client talk to that person. And you have the client say what you may give instructions like, why don't you tell this person some of the things that you think, but you've never been able to say? And so you let the person talk, and you get to see whether or not the person feels, positively about their intimate friend or about their boss, or they feel negatively, or they feel conflicted. And you listen for the content. What are the things that this person has great difficulty talking about? In fact, they haven't talked to this other person about it. And then when the person does that, you get, them to listen to themselves and to listen to, especially to how they feel. And you use that as a starting point to get a sense of, well, how do you feel when you say to your boss, you have never appreciated me? Or you say to your boss, you're really a very arrogant person, and it's very difficult to work for you. In other words, when someone gets out that kind of anger, do they get very anxious? Do they find that this is real scary? Or do they find once they've done it, actually they feel more comfortable, they feel like if it ever came to it, they could do that? Or if they're talking to their lover or their friend or their spouse, and the person says something like, you never say thank you to me when I do little favors. And I've often wondered, why don't you do that? And then you might, ask your client things like, why is that so hard for you to say? I mean, why can't you simply tell someone that you need more feedback, that you need to know that when you're trying to do things for someone you care about, that the person actually is experiencing that? And you may get all kinds of reasons, like the person feels, if I have to say that, it doesn't count, because people make up internal rules. Now, another thing that you can do with this kind of observation is you have the client imagine that he or she is sitting in that empty chair. And then you have the client talk to himself or herself. And what happens then is you say, talk about whatever you'd like to talk about often. You start off very unstructured. And if you find that the person is harsh with themselves. That is, they start talking to themselves and they say, you're not trying hard enough. You're late for work all the time. You don't save enough money. You're behind in school. But when the person talks to himself, as you're there listening, you're recognizing, boy, this person has a lot of anger inside himself about his own performance. And when he talks to himself, he's very harsh. So then you might have other people talk to you. Imagine you're sitting there and pick out, this person or that person, and like have your mother, have your teacher, whatever, talk to you, and then you listen. And you see, does the conversation differ? For instance, is mom someone who's very supportive and caring and says nice things, the teacher is very harsh? Or is it the other way around, that everything that mom says is kind of disparaging to this person, that anything that she sees in him tends to be negative? However, you find there is a strength in his culture because he has some teacher who actually is very kind and very generous, and he experiences that. Also, you might find that none of the characters the person chooses ever really says much that's positive. And so you begin to get a sense that this person who is sitting with you now, when he or she is in their world is a world that obviously creates a lot of anxiety. It's a world that doesn't have many interpersonal rewards. It's a world that it wouldn't be fun to be in. And you may pick up that as a result of this, the person that you're seeing is probably very depressed, because what they report to you is they don't say any of these things to people, so they don't get any of this distress out. And their anticipation is, of course, if they ever did say anything, all they would get is negative feedback. So that kind of observation, which is really not quite naturalistic, because you're not really seeing the person with the teacher or others, but some very meaningful generalizations can be made from gathering those kind of data. Also, there are some people who will use this technique more than once. So you might use it in the very beginning of treatment to kind of get a sense of how things are socially. You might use it later to see if anything has changed, to see if now when the person talks to himself or herself in the chair, they talk differently, that they've begun to see some positive things they didn't see before, that there's not that harshness that was there before, that the social world is opening up. And if it hasn't changed, of course, it's diagnostically very meaningful. It means that, in a sense, while perhaps it seems we're making progress in our session, when you really look at this person as he or she sees themselves now, they don't seem to see themselves all that much differently than when they first came to see you. Now, the textbook also makes reference to kind of styles of gathering data, that there are physiological tests that psychologists use to measure, what they want to do is measure a certain physiological activity, like heart rate, respiration, blood pressure, galvanic skin response, muscle tension, brain waves. All of those kinds of physiological indicators have been used with clients to learn certain information. Of course, brain waves, for example, if you're familiar with biofeedback, often biofeedback has been shown to be a very effective intervention in helping people learn to control their headaches. And actually, it's a common treatment today. Now, one that was used for a period of time was physiological arousal was studied in persons who had sexual issues. They were used for people, for men in particular, who were either impotent, men who had committed rape, or men who were pedophiliacs. And what they did is they took electrodes and they put these electrodes on the person's penis. Usually, by the way, just talking about this gets people anxious. But they put the electrodes on a person's penis, and then they would have visual stimuli. They would show the person whatever it was that perhaps they thought this person had difficulty with. So they might be showing a very sexually arousing scene if the issue is impotence. They might be showing a violent scene if they want to see how this person responds who has been found to be a rapist. They might also show, traditionally sexual scenes and then violent scenes and see, does this person only get aroused by the latter? And of course, they would show pictures of perhaps children to see if that becomes very arousing for a person. What they actually found out was that this is not really a naturalistic setting. I mean, you got somebody sitting in a room, there are other people there, you put electrodes on the person's penis. This is hardly... Yes, yes, this is not quite real life. And the data they got from this wasn't, they ended up feeling this is not very reliable. I mean, they didn't really learn much about this. And also in terms of the latter group, pedophiliacs have been much in the news lately because of all of the cases of Catholic priests who have been found to have been sexual with usually young boys. And one of the things that's come out that is important to know is not only have we not been able to study this phenomena very well, but actually we haven't developed really any meaningful interventions. I mean, one of the really unfortunate things is not only is pedophilia obviously a terrible act, especially a terrible act for the child that has to undergo this, but we really haven't learned enough about what motivates people and how you might intervene to change that. And psychologists actually have been saying this for a long time. In fact, when the bishops, the Catholic bishops came out and kind of almost went far enough to say, we're very surprised to see there's so much of this, there were psychologists who came out and pointed out that they actually been telling these bishops for over 20 years ago how serious this problem was, that there wasn't a good way to treat it, and importantly that recidivism was very high, so that when the people went back, if you exposed these priests to young children, it was highly likely they would act out again, and of course that's exactly what has happened. So this is one disorder where once you diagnose it, you're in a very tough situation, because we really haven't figured out yet just what might be effective, and we probably most often recommend that you simply have to put the person in an environment where that particular issue is not likely to be one that's experienced. So you don't have this person working with young children or being alone with young children, because the possibilities that something sexual again will occur are very high. Now, probably the closest we come, where naturalistic observation actually it can be very diagnostic, is with children. Child psychologists often put a child in a room, and it may be structured, that is, they may have some specific toys in there. They want to see how the child will play with those toys, and children seem to just go in and play. Their fantasies seem to be active. You get a sense of whether this is a curious child, an aggressive child, a frightened child, a creative child. I mean, just giving them things to do and just watching what the child does often gives you a lot of diagnostic information about the internal freedom of the child. That is, this child in there trying out all kinds of things, and if you put in a unique toy, do they go and try to figure out what to do with the unique toy, or do they avoid the unique toy and use only things that are familiar? And when they're working with something and they're having difficulty with it, do they stay with it? Do they still keep trying to figure out, now how do you get this toy started? Or do they get angry? And if they get angry, how do they handle their anger? Do they just abandon the toy? Do they take the toy and fling it against a wall? Lots of information you can gather about children, and it seems to be very helpful. But in most other situations, as soon as we start observing, we have a difficulty. In fact, yesterday, Mr. Jones brought up the Hawthorne Effect. And I think I was too quick to say that this is something different. This is slightly different, but actually the Hawthorne Effect, which was established doing research on people in jobs. And what they found in that particular study was, if you go in and you watch people working, in other words, you want to find out what are people's habits and how did they do, the very fact they're being watched causes them to work differently. So the Hawthorne Effect is, if you actually are observing someone, at least in the original, in the work setting, they're really not the same way they are when they're not being observed. And indeed, that's what you find out in much of this kind of observation too, is if you want to observe adults, adults do change their behavior because they are being watched. And in the movie I was telling you about yesterday, where you have the social scientist, sitting up on this high chair in the kitchen, watching somebody 8 hours a day. Over time, you began to see that the person changed his behavior. These were all males they were observing. And you began to see the impossibility of the person in the chair being this neutral person. I mean, and you just think about it. I mean, sitting in your kitchen, this is not exactly a big room. And here somebody's there 8 hours a day watching you, and you live alone. So eventually, and the guy who was directing this was wonderful. The guy who was directing this comes to see the main character in the movie at one point and reveals that another guy who is doing this observation is now having an affair with the man that he's been observing. And so the man who's in charge of all the research, of course, is just flummoxed and upset that this is not the way it's supposed to be. But in the end, what you begin to recognize is that you simply can't create a totally neutral environment that is so similar to the environment people are usually in that you can then make direct observations about how somebody behaves and assume that that really is them. The exception, I would say, is one I just mentioned, and that's with children. With children, it's amazing how much they seem to tell you. The other area that psychologists use, and this does work, is with people in training, it is not uncommon for them to tape record, and usually it's audio tape, psychotherapy sessions. And of course, you get the client's permission. It is stunning, by the way, rarely does someone refuse to allow a session to be taped if you ask them if it's okay if it's taped. But once you start taping, there's not much evidence that the sessions are any different than if you didn't tape. That is, the client, in fact, since the tape recorder is off to the side and the mic is small and just sitting there, it's fairly unobtrusive, and since after the first time you raise this issue, you just turn it on when the person comes in, so it's not very much in evidence. The content of sessions seems to be about the same as it would be if the person didn't use it. Occasionally, when someone is taping, especially if you're working with someone who perhaps has some paranoid ideation, they may ask you to turn it off because they want to say something and they don't want it to be recorded. That's fairly rare, actually. Most of the time, people are comfortable with it. And then that is very helpful for the student therapist and for the supervisor to be able to go over the tape and to talk about what happened. And of course, in that situation, there actually are two people who are being observed, because you're trying to understand the client and what kind of assistance the client needs, what kind of intervention will work, what's the best way to work with this person. But you're also focused on the therapist. Is the therapist being empathic? Is the therapist listening to the real issues the client is raising? Is the strategy the therapist is using one that the client really can understand? Depending on the theoretical frame of reference, if it were a cognitive behavioral person, you might be focusing on, how did the therapist come up with a homework assignment? Is that a realistic task to give a client? When the client comes back, do they report they really tried to do what you asked them to do? If it's a more psychodynamically oriented session, you might talk about the way in which the client is getting angry with the therapist. Is the therapist doing a good job of being able to let that person be angry? Is the therapist comfortable with some of the rage that's coming out of the client? Are some of the interpretations the therapist is making right for that stage in therapy? So there are lots of things that go on if you use a tape, and they can be very helpful. And that's one form that does seem to be pretty accurate. Okay, now that brings us to this interviewing and observational section, and we finished with that. And as I mentioned, we're now going to go on and we're going to talk about testing in clinical psychology. And one of the things about testing is that, it's certainly very much identified with clinical psychology. I mean, there's a long history of psychologists using tests. In many ways, the profession itself got started using tests, and only later, as you know from the history we discussed, did psychologists actually get involved in intervention strategies. And of course, the first issue that you have to deal with is, what is a test? And when I say things to you, when I say to you, what is a test? What comes to mind? Whatever, just when I say what is a test, what do you think?
Battery of questions used to test your knowledge of a particular.
Okay. So the first thing that comes to your mind is a test is something that's going to test my knowledge. Okay, that's fine, and that's very accurate. What else comes to your mind? What is a test? Sure, Mr. Oponi?
Yeah, it means for assessment, you have certain items you're going to ask somebody to get, like you can ask questions about, if you have a career, like a test, where they figure out which would be more geared towards, just to get a bigger picture of somebody in general.
Okay, great. So you're saying what you think about is when a test might be a vehicle to better understand some particular aspect of a person, like if a person wants to know more about their career, you might give them a test that would help them to understand what career path might be best for them. So that very different test than what Mr. Jones said. Ms. Burrow?
I would say it was something like a procedure to find out something about a person or
Okay, so you're saying a test has an intention to learn something about a person, and probably that's predetermined. That is, you already know what it is you want to learn about them, but you don't know enough about it, so you give them a test to find out more about this person. Okay? Now, if you listen to those three examples, I mean, you can see they're very different. That is, tests cover a very broad range of things. And tests, normally are developed to examine questions. And, depending on what the question is that you want to answered, the tests can be dramatically different. Also, the way in which tests actually give us data can differ greatly. Some tests are arithmetically scored. You just take the number of right and wrong answers. I mean, if you take an IQ test, for example, the number of right answers leads you to a score, and you just add them up. This is also true on some tests of psychopathology. That is, the number of items that you answer in the direction of being pathological will get you a score, whether it's a score on an anxiety scale or a score on an obsessive scale or a score on an alcoholism scale. But you just add up all the items that a person answered in a certain direction, and that tells you how high they score. Now, when we say how high they score, we always mean in these kinds of tests that we're comparing our person to a group of people who are the so-called normals, and usually to a group of people who are the abnormals. So everybody gets a score. So let's say we have no one in the room who is alcoholic, and we give out our alcoholism test. Well, you're not all going to score 0. You will score in some range, and that range is where people who don't have a serious problem with alcohol score. But if someone had a serious problem, they would score higher. And so you're differentiating normal behavior, that is the usual expectation you would have for someone, from those where there's a serious problem. That is, they answer almost all of the items, or a great number of the items, in the direction of the syndrome that you're trying to examine. Now, just to start with and to give you a contrast, the contrast is with tests like that we call projective techniques. That is, tests like the Rorschach ink blot test or the thematic apperception test, both of which we're going to discuss shortly. But they have very subjective scoring systems. Often it is first of all, the clinician gives the test, if we take the Rorschach inkblot test, and then depending on the approach the person takes to the blots, you end up getting people making inferences about how you would go about scoring this. Same is true of stories that are told in the TAT. I'll be more clear about the Rorschach in a minute, by the way. But you have someone tell a story, and then you make observations about the interpersonal effectiveness of the people, about the emotion that's in the story, about the person's past, about the person's future, etc. But it's not like having a nice item where you just go true or false. You can score it very simply. Now, it really is important for you to recognize, too, that in clinical psychology, not only are tests important, but the profession really has struggled in trying to develop, truly valid and reliable tests. We talked about validity and reliability in terms of tests and interviews earlier, but it's a difficult task to make sure that that a test really is valid, that it's reliable, that it's measuring what you want it to measure. And tests can always be better. So even our best tests are usually undergoing research to refine them and to make them even more accurate than they already are. Now, in the world of testing, it's also important to be aware of whether a test actually measures a specific phenomenon. Is the test able to directly tell you about the phenomena you're studying? Now, you might get something like if we had our alcoholism scale, and you're asking lots of questions about drinking behavior, and you're asking lots of questions about like when the person does drink and how much they drink and whether they lose consciousness and all of these things. You're pretty much testing the phenomena itself. That is, the focus is heavily on alcoholism. There are other tests that psychology has developed that simply correlate with some phenomena. That is, if you score in a certain way on this test, we assume certain other things out here will occur. Great example, the SAT test. All of you are familiar with the SAT, or maybe you took the ACT. Now, the premise is, if you can answer these questions on this test, you can answer a lot of them, that is, you can score high, that means that you're going to do well in college. At least that's what the hopeful prediction is. This is also true of the graduate records exam. If you take the graduate records exam, the idea is if you can score well on this test of a certain kind of knowledge, then in graduate school you will do well. That's not true. That is, the data don't support that whatever you got in the SAT or whatever you get in the GRE is going to lead you to be a really good student, average student, poor student. Now, why do you think that is? Why do you think? Oh, well.
Attention.
Well,
the building fire alarm has been activated. All occupants walk to the nearest available exit and evacuate the building. Do not.
Well, those who are watching this on television will not realize, but we just had a fire alarm, and so we're going to lose a few minutes in this class because we had to leave the room. However, we are back. And when we left, we were talking about tests that correlate with the phenomena. And especially I had mentioned the SAT and the graduate records exam, and the fact that we know that they are not really great predictors of success. And so the question I had just raised is, Why do you think that someone who scores high, let's say someone scores quite high in the SAT, why do you think that doesn't predict that they will do much better than, let's say, someone who scores significantly lower than them?
College,
Right, in college, yes.
because it's like a different environment. It's like in college, a lot more of the work that you do is placing your responsibility. Like in high school, you have like homework and all that kind of stuff.
Mhm.
It depends mostly on the character.
Okay, great. Example. Mr. Kim says, that the environment is a big factor in whether you're going to do well, and so perhaps motivation is an issue. Do you think that's true? You do.
Right. Yeah, it doesn't measure your like diligence, right? Like the tests don't measure your like how hard you work. So
Mm-hmm.
that can,
What about the fact that other things become an issue when you're in school, besides just taking the test? Working, family,
Mm-hmm.
that could interrupt it.
Okay. Yeah, it's a great. You're using great examples, like work and family might come in. In other words, we've got this very bright person, but she's also got 3 small children, and she works. So, is she going to get all A's? Maybe not. But what the test suggests, she probably could get all A's. That's what the test actually suggests, is this person is really very bright. She could probably do quite well. But is she going to is a totally different issue. And we find with some people, for example, that you get 2 people who are very bright. One gets all A's, one gets some A's and some B's and a C here or there. And so the question becomes, why? Well, sometimes you find that the healthier, maybe more mature person is the one who got the mixture of A's and B's and C's. Because the person actually pursued those things that he or she wanted to pursue. So they took, Finance 1, and they found this very interesting. So they worked real hard at it, and they end up getting an A. At the same time, they were taking Chaucer. And they found out that they really didn't, Chaucer just wasn't what they thought it would be. It wasn't that interesting to them, even though they might like other areas of English. They didn't like Chaucer. So the person gets a C because they're not going to put that much energy into it. Now, there are other people who are going to get all A's because they're so driven, they can't do less. So this person gets an A in finance, but whether they liked finance or not would be irrelevant, because they just feel I've got to strive all the time to do well. And they would get an A in Chaucer, even if they disliked it a lot, because getting anything less than an A is not acceptable. So, sometimes you find that there are some very complex issues, some pathologies actually, that drive people to do well. And our tests don't account for this. Our tests are simply kind of a measurement of general ability. So you want to keep in mind that the tests have become part of our culture. They do seem to measure some variable, namely intellectual information and potential for learning, that are helpful in college. But when you get down to saying they're predictive, there's a lot of room there for error. It's interesting, and psychologists, of course, got interested in this phenomenon. There was one interesting study was done to determine, how helpful is on the graduate records exam. There is a verbal test, and most people who go into graduate work in psychology do very well in the verbal test. There's also a quant test. And some people do much better than other people. In fact, some people do rather poorly in the quant part of it. And so the question became, should we be using these tests? So a person did a study where he examined the scores of students who were in fairly rigorous scientist, practitioner, doctoral programs, say like the one here at the University of Houston, like the ones in most big public and private universities. And what he learned was that if you score below the 50th percentile on quant, you probably won't be able to get through the statistics area of a PhD program. That is, if your ability and perhaps your information in quantitative methods is lower than the 50th percentile, it is highly likely that you will fail. You will not get through a PhD program. However, what he also found was you couldn't differentiate between those people who scored over 50 and those people who scored as high as 99. That is, if you made a certain minimal score, which he had determined in this case was 50, then the issue simply became motivation. That is, you had the ability, you were able to score 50, then it became a matter that maybe somebody who scores 60 is going to have to work much harder than somebody who scores 90, but the reality is the person can do it. And since in a field like clinical psychology, the graduate students are also motivated, it's really not an issue. That is, everybody will get through who scores this way. So it's important to recognize with a lot of these tests that they give us some information. In this particular case, probably knowing that somebody scored at the 38th percentile might be an indicator they shouldn't be going into a doctoral program in clinical psychology. But to say that they scored at the 55th percentile and they won't make it, the studies would say, no, that's not true. So there's an awful lot of leeway there. Now, well, we have a mysterious ping.
It is safe to return to the building. Safe to return to the building. Thank you.
Those of you who are watching this on tape will realize that this class returned to the building, apparently, before it was safe. I do want to tell those of you out there, we actually did ask if this was a false alarm, so you will know we didn't just come back in and risk lives, but actually we were told that this was not. Okay. I'm going to talk with you now a bit about IQ testing. And of course this is a field that's been associated with psychology for a long time. And it's interesting too, IQ tests, probably more than any other tests, have a lot of acceptance with the general public. The one exception has certainly been some minority groups who have pointed out that the items in IQ tests are often oriented to majority populations. And so if a student is exposed to a different kind of education, especially early in life, they may have less information, or they may have been exposed to different information, so they will get less items correct on an IQ test, and it will look like they don't have the ability. Now, what actually has been shown in these tests as it's gone on, since this was brought up, especially by African Americans, people began to be worried that the tests are biased against African Americans. Actually, the bias in these tests, and there is one, bias may not be the right word, but it's really against the lower socioeconomic status people. And there's just a preponderance of people in the lower socioeconomic status who are African American. But being African American is not the issue. Being poor is the issue. And even more than that, being sent to a school that is not nearly as good as the schools that the kids who are in middle class go to makes a big difference. So the tests even may be measuring the information a student has, but they're not measuring, certainly in some cases, the ability a student has. So you do disadvantage lower socioeconomic students, and since many of them are minorities, you disadvantage minorities by using certain IQ tests. Now, the focus, to overcome this, one of the things that's been done is there's been an attempt to try to create culture-free tests where, like the vocabulary you have, let's say, will not be a factor in the score you get, so that those students who have been exposed to a richer vocabulary and more reading and more English won't have an advantage over those who don't have that exposure, because the idea with IQ tests is you are trying to measure potential. We have made some progress in making tests more culture-free, especially when we can create subtests in an IQ test where you measure someone's ability to, say, arrange pictures, or you can measure their ability to do concrete tasks. In other words, tasks that don't require you to have had access to certain kinds of verbal learning. But we don't have any terrific test, and we know, and there's a long history of this, if you go to a school, grade school especially, and then a high school where you don't get the same quality of education that you would get if you went to another one, that will influence how well you do on some of these tests. Now, there's an argument about what is intelligence. When people have argued for a long time about the meaning of IQ, and I've just spent some time now talking with you about the fact that when you ask yourself about IQ, there's a tendency to think that that's an innate part of you. That is, you either got it or you don't. You either have a high IQ, you don't have a high IQ. And the studies show that that's probably about 80% correct. Probably about 80% of your IQ really does come to you genetically. That is, that ability in you to be able to understand very abstract concepts, that ability to memorize, that ability to learn various things, that ability to work mathematically, etc. Probably a lot of that is genetic. But if 20% is not, then you have the issue I mentioned to you about schools. That is, the kind of exposure that you would have in your home and the kind of exposure you would have in school, and the kinds of internal motivations that you develop, whether you want to do well or not, will determine what your IQ is. Now, in our next class, we're going to start talking about just what is intelligence, but we'll take a break for now.